Okay, we are live. You can start at your discretion, Mayor.
Wonderful. Good evening, everyone. Thank you for joining us. I'm calling this emergency meeting of the Silverton Board of Trustees to order at 6:05 p.m. on June 1st, 2020. If we could do a roll call, please.
Give me 1 second to get Miss Freeze on the phone. Kelly, can you raise your hand for me? Or actually, you can't do that if you're on the phone. So give me a second. What are the last 4 of your phone numbers?
Can
We're
everybody
ready
hear
for a
me?
roll call. Yes, we can hear you, Kel.
Trustee Barella,
Here.
Trustee Lashley,
Here.
Trustee Bierma,
Here.
Trustee Wagert,
Here.
Mayor Pro Tem Barney.
Here.
Mayor Furman.
Here.
I'm missing one of you and I'm drawing a blank at the
Harper's here.
Harper. Sorry, Jim.
Wonderful. Thank you, Kelly. So I'd like to read a quick statement before we get started to help guide us a little bit. And I will do that now. So I'd like to take a moment to note how fortunate we are to call this mountain community our home. And that during these globally chaotic times, the issue facing us tonight is limited to whether or not we adopt a mask ordinance. And I think that that's a good place to be. To provide everyone with additional context around tonight's discussion, the town received a letter from the county commissioners this past Thursday, May 28th, requesting that the town of Silverton adopt an ordinance requiring the mandatory wearing of face masks. This meeting and our discussion of such an ordinance is a direct result of this request by the county. In a few minutes, we're going to hear from our public health director and her thoughts about the use of face coverings and limiting the spread of the COVID-19 virus. And as a reminder to the public and the trustees, the process required of this board is to receive advice and testimony from experts and to make a decision based on that expert advice and testimony. Our goal tonight is to determine the best way to follow the advice of our community's health professionals, who are telling us that the more we are able to encourage the use of masks, the safer our community will be. The members of this board are not health professionals, and we're not going to debate whether or not face coverings are a useful tool in limiting the spread of the COVID-19 virus if that's how our health professionals advise us. We will also not be discussing the conflict between recommendations by the World Health Organization and the CDC, second guessing our health professionals or any other sources besides the health professionals that are telling us advice tonight. I encourage and appreciate this community's input and request that this input be framed around how we can encourage the highest number of residents and visitors to follow the advice of our health professionals. And following the input from our health professionals, we will hear from the public, and then we'll have a discussion balancing the health risks of this community with the social and economic impacts of whatever decision we come to tonight, and that no decision was made prior to this meeting, and that we are open-minded to the suggestions of our health professionals as well as all the community members present. So with that, we'll start our formal agenda, which includes any revisions to the agenda, of which I do have one significant request, is that the letter from the county commissioners be included in this meeting packet and officially be part of the record. And I'm curious if anyone else has a revision to the agenda. All right, with that, We will be opening it up for public comment. Each comment's limited to 3 minutes, and I'll be keeping track of that. And please be courteous and kind, and let's focus these comments on how we can best serve our community. I have, and one last request for any public comment, please introduce yourself and state your primary address. So I'm gonna be, I see 2 hands up right now. The first one is Bill Walco. Bill, can you hear us?
Yes, yes,
Right.
Bill Walco, 1159 Blair Street. I have a couple of concerns about this. The first relates to the limited notice. I understand there was a short time frame because this is an emergency meeting, but I also wanted to call attention to the board the fact that the meeting packet states 7 p.m. tonight, not 6 p.m. So there may be many residents that are expecting to join this meeting at 7 o'clock, and much of the discussion would be over by that point. That is very troubling considering the nature and the sensitivity of the subject. My next point is I'm very concerned about the interface between our visitors and our community and how we would go about communicating an ordinance that has an enforceable feature to it. Don't want to be in a situation where shopkeepers or employees are feeling pressure to enforce the ordinance for patrons within an establishment where they're wondering if they're going to be liable under this ordinance and its enforcement provisions that are chosen. If a customer does not comply or refuses to comply, would a 75-year-old clerk or business owner be required to escort somebody out of their premises that refuses to comply? Are they going to call the town? What if it's a weekend? What if it's the evening and no one's on duty? Does the sheriff's department get involved? What is the nature of the enforcement that is pictured with this? Very troubling in terms of where we go with this. So I think that before anything gets agreed to, it needs to be very, very well understood how this would be crafted. Thank you.
Thank you. Thank you, Bill. All right, the next comment I see is from, the next hand raised I see is Kara Pendleton. Kara, do you hear us?
Well, my name is Carla Pendleton. I'm a Silverton resident. I live at 1550 Mineral Street. And I'm kind of confused, like Bill is, about, first of all, how this would be enforced. So I agree with his comments. It's not very clear from the ordinance enforcement how that would be handled. And I'm also concerned that the government, the local town and county government seems to be overreaching into people's personal businesses. I don't understand why we need the government to tell us how to protect ourselves using social distancing or masks or whatever the case may be. Most of us are quite capable of determining that for ourselves and determining our risk level for a virus of any kind, whether it's COVID-19 or any other virus. And I think shop owners and business people are also very capable of determining who they want to serve, whether they want to serve people who are masked, unmasked, gloved, ungloved. I think that's a decision that should be up to citizens and to the business owners. And I think that's about all I have to say. Thanks so much for listening.
Thank you, Carla. The next hand raised I see is just a first name, Cole. Cole, if you could please introduce yourself and state your address.
Hey, you guys, this is Cole Davenport. I own 133 Green Street. I feel the same thing about these other people that have come across on the last few comments. Owning a dispensary and having people come in as an essential need. A lot of people do respect a lot of the masks that do come in. And of course, I was in the military, probably had a lot of shots and things of whatever that had probably immune to everything. But I know that people around me have been tested, came back with antibodies or negative. And knowing that these people come back negative, I am not yet to be sick at all this year, thank goodness, knock on wood. But, you know, it goes back to what the madam said before earlier. It's, you know, going and infringing on people's rights, but also how do you control how many visitors come into town and what they do? I mean, it's like the gentleman said before. These guys are how are they gonna sit there and how can we actually do crowd control? I mean, that's infringing on people's rights too as well. But you know, that's all pretty much said. It's not just going back to being a dead horse. I just see a lot of people coming in from all over the place, and these people want to spend money in this town. But if we're running them out or telling them they can't do anything, it hurts. It hurts us all. It hurts every one of us. But that's all I have to say. But thanks for listening as well.
All right, thank you, Cole.
Hi.
The next hand raised I see is Carl Com. Carl, you have the floor.
Perfect. Can you hear me okay?
Yes, we can.
Great.
Just name and address quickly, thanks.
Yeah. Hi, friends and neighbors. My name's Carl Com. I've been a year-round Silverton resident, live at 1228 Snowden Street for 6 years, and I work as a physician assistant. I've been at Mercy Regional Medical Center in Durango for the past 5 to 6 years, and also work in Alaska for small Native communities. COVID-19 has been exceedingly difficult. There's been a balance between limiting spread and flattening the curve and allowing regular economic and social activity. These decisions have been very difficult and the consequences real. However, in my view, wearing or not wearing a face mask is not one of these difficult issues. From a medical perspective, it's painfully clear that face masks are effective. Multiple randomized control trials in medicine, we like those because they're very helpful, specifically on COVID-19, have shown this to be true. In fact, research from UC Berkeley and Hong Kong shows that if 80% of the population wore a mask, the pandemic would largely be halted. The CDC now advises wearing them. Unfortunately, like Shane said, the World Health Organization's guidelines are confusing and unhelpful. The Colorado Department of Public Health also advises mask wearing. It's crucial to understand that masks protect other people much more than the wearer. It protects people who may become very ill or die from COVID, such as the elderly and those with medical problems. And everyone should wear one because infected people can be without symptoms and not know that they are infected. I understand that some businesses are wary of scaring away customers by wearing a mask. It's clear that mask usage is part of slowing the pandemic and reopening businesses, something which we all desperately need. If Silverton becomes a COVID hotspot, the consequences of that are obvious. Why should mask wearing in public places where social distancing is difficult be an ordinance? It's because driving too fast on the highway is illegal because you might hurt other people. It's because burning trash in town is illegal, because smoking in public buildings is illegal, because not wearing a mask may hurt another person. Since there isn't a significant downside to wearing a mask, many of us in medicine are frustrated that this issue has become political. Protecting the elderly and people with chronic medical conditions has nothing to do with politics. Wearing a mask is an act of caring, and requiring them is the responsibility of governments. I think this is a reasonable thing to do, and I strongly urge you to make this an ordinance in Silverton. Thank you.
Thank you, Carl. The next hand I see raised is Scotty Peterson. Scotty, the floor is yours. Peterman, my apologies.
That's okay. Thank you all for letting me speak this evening. I just want to quickly repeat some of the things that have already been said. First off, I will say my husband and I strongly agree that we ourselves have decided to wear masks 100% when we go out in public, that we know there will be several people there. That's a choice we made. Being an American, that gives us the right to make that choice. So I also state that I feel like if you make this an ordinance, you're removing our right to choose. And I don't think you or anybody can make that decision. I would hope that you think we are all responsible enough that we will be safe. I think the business owner should be able to choose whether or not they want to require masks in their business. And I just also agree that it would be really hard to regulate this, and it would already put added stress on a department that is really busy in the summer already. And I just implore you that if you do decide to make this a demand, that you at least make the option to review it on a more timely basis and not make it for a month, or, you know, maybe review it bi-weekly to see if this is really making a difference, because I think it would hurt the town, and we've already had a lot of bad press, and I feel like this might hurt it even more. So I just want to thank you for your time and letting me speak my words. Thank you.
Thank you, Scotty. The next one pops up as Samsung SMN920V. If you are able to tell who you are, I'm clicking allow to talk for you now. If you could please introduce yourself and state your address, that would be great.
Yep, so this is Paul Zimmerman. I live at 1440 Mineral Street. My wife and I also own the Pickle Barrel and Smedley's. I would like to comment. I don't believe it's right to actually write a mandatory law for this or ordinance, short-term, long-term. I think even the CDC and everybody has shown that outdoors, the spread is almost impossible. And I will also like to say, so this week I had somebody bring me a pulse ox meter as I wore it waiting tables, and it drops my oxygen level 4 to 5% from about 95 down to 90, 91. There's a lot of people up here that are walking emergencies to begin with. If you're going to make them wear it outdoors, indoors, all the time, you may be creating more health problems that we haven't thought of. I'm not a medical expert, but that's the impact it had on me. So I appreciate the time. Those are my issues. I just don't think it's right to write a law. I think people will do the right thing if you recommend it. So I appreciate your guys' time. Thank you.
Thank you very much, Paul. And the next hand I see raised is JP Stanley. JP, the floor is yours.
Can you guys hear me?
We can now. I just unmuted you. Go ahead.
Okay. So thank you for accepting my ability to speak on this. I just think that.
Sorry, JP, one sec. Just name and address, please.
236 West 14th.
Thank you. And I already said your name, so I guess we're good.
Yeah. Hello, everyone. I would just like to add that something that I thought about today when I went into the hardware store was I looked over and I seen the oxygen tanks that people buy when they come into Silverton. And just this is kind of an off-skew view on it, but the people that come here usually come here from lower elevations, way lower elevations. And I was thinking about the fact that they buy these oxygen tanks so that they can just get through their trip through Silverton. And if we add masks to that situation, then are we adding more to our EMS as far as responding to people that are not breathing properly, like that can't adapt to the atmosphere up here or to the elevation up here. And thinking about that, that should be an issue, I would think, and causing more EMS calls for those people. And that's it.
All right, JP, thank you very much.
Thanks.
Any other public comment at this moment? I do not see other hands raised. I suppose then we will close public comment and we will move on to the next item of our agenda, which is presentations and proclamations. And for that, we've asked our public health director, Becky Joyce, to join us and speak about her advice with respect to the trustees and the discussion for this evening.
Hey, thank you for having me on. And it was just really great and valuable to hear people's input and opinion on this. I know it's a really difficult issue. I feel like we're all decisioned out and it's been a long 3 months. So I really just want to extend my gratitude to the town for doing such a great job with what we've asked you to do so far with social distancing and mask wearing. So truly, I just want to make a couple comments on, I think some people are definitely at odds with the mask and the facial coverings because, you know, it took a while for them to actually advise us to do so. In fact, in the beginning, they advised us not to do so. But what I'm reading is that the experts really didn't know the process of this disease. They didn't realize that the spread of the virus could happen before symptoms appeared. And they also didn't realize that individuals could be asymptomatic and still spread it. And so I think that was a little conflicting for a lot of us, myself included, of, well, why now? Why do we need to wear masks now? Why were they saying we didn't before? So, you know, I think they know a lot more. This is a novel virus, it's new. So essentially, I will always recommend and advise people to wear face coverings where we cannot socially distance. And that includes inside. And I've seen a really good participation in this community. I've also seen some pretty steadfast, diehard people absolutely refuse to wear any kind of facial coverings. And, you know, I absolutely agree with a lot of the comments that, you know, we're adults here. Can we be trusted? Can we make the right decisions for ourselves to do this? And there are a lot of really great public health laws out there to help protect population. We look at population versus individuals because that's herd immunity. So, you know, I'll always wish for everybody when they go indoors somewhere to be able to wear a mask or a face covering. And two of the biggest reasons that I wish for that is because there are quite a few people who have come to me who do not speak out in meetings. They don't want to be conflicting or confrontational, and they're employees of these establishments. And some of them are nervous. Some of them don't know why all people can't wear masks because they need to work. They need a job. And then the other reason is I have a young family member with type 1 diabetes. And when I watch her get close to the flu, she pretty much ends up in the hospital. And I don't understand, you know, the why it's so difficult to wear a mask going into a store, why that puts people out so much that they would endanger someone like my young family member. And so what I really want to say tonight is, we're not here to debate the efficacy of facial coverings and mask wearing. CDC, CDPHE, Mayo Clinic, we go to them when we have a real need and we need to get something solved and fixed, and we trust them with that. They're asking us to wear facial coverings right now. So I'm going to trust that their medical experience is far greater than mine and their wisdom. And I want to also protect those who can't quite speak for themselves. So the biggest question here is, if not an ordinance, what results in the most facial coverings to be worn here? What can we do as a community to encourage this and make this happen together? I hear you when you say you do not want an ordinance. You don't want one more rule being placed on you and being told what to do, and the possibility of economic downfall and social stress and angst. I understand that, and I care deeply about that as well. So how can we come together as a community? What would make that happen? Would that be a public health advisory with required signs at a business with available masks for people to be asked politely to consider wearing a mask or a facial covering just to protect the employee and other people who are in the shop who may have conditions that makes them more vulnerable to if they got COVID. So that's my ask tonight. I'm not coming here saying we must have a rule, a law, an order to do it, but what I'm coming here saying, let's continue to keep our community going on the track it's going on. We're doing so good. And I'm so excited to see all these businesses opening and to see people getting out. We need this. We need this physically, mentally, socially, emotionally. What can we do to create the most success in doing the interventions, such as mask wearing, such as hand washing, such as social distance?
Becky, if you can
and
hear
beyond.
for a minute.
Yeah, I'm sorry. Did I get to my 3 minutes?
Yep, you're back.
All right, so that's my comments tonight.
Oh, no, I'm sorry. I
Thank
was
you very
saying that
much.
you dropped off for a minute. I wasn't saying that you were out of time. Apologies.
Oh, I'm sorry. I don't know what I ended on, but I essentially just say, what can we do as a community to keep our season going and our lives going instead of having an outbreak or having to, tighten up things because we've had an outbreak. So just to be a successful community, how can we support each other? What ideas do you think will work? And how can we best continue to open up better and economically better, and then to stay open? So thank you for letting me speak. And I'm sorry that we're putting you in this really difficult position, but I think we can find a solution together. And thank you again for your time.
Thank you very much, Becky. Do we have any other presentations, or is it time for our trustee discussion? Without seeing any hands raised, I'll turn this to trustee discussion relating to this emergency ordinance. And one process question I would love an answer to real quick from Attorney Koznick is whether Mr. Walco's concern was founded, or did we properly notice this meeting, and was the typo that I believe the town did catch shortly after sending out the agenda a significant issue?
Would you like me to respond, or?
Yes, please.
So was there, let me ask a question. Was there a modification posted of the time once it was caught, or is the only notice that was posted stating 7 o'clock?
Yeah, Mayor Furman caught it on Saturday and we went in and corrected it An idea I would propose is to move after the trustee discussion, if we're still before 7, move on to another agenda item until we get past 7, and acknowledge anybody that has joined at 7, that may have looked at or downloaded the agenda on Friday before we caught the conflicting times.
Trustee Brewer.
It was also a very major issue, and I was aware that it was brought to town hall's attention that none of the links would open, not even the one I received. So I couldn't even get the packet neither way. So I'm not sure what's happening, why the breakdown is, but there are a lot of people that called me today and yeah, couldn't even download it. So the second item that just about this meeting, and we need to make sure we bring the public back in at 7 because the link works now today, but a lot of people could not get it until today.
So I think we need to follow the direction of Attorney Cosmic and Administrator Ryder and whatever you suggest in proper procedure here.
I think Mr. Ryder's suggestion was appropriate, that, you should at least continue your decision until after 7 and allow the public to have another opportunity to discuss this, just to give them a fair and opportunity, even though it might meet the legal requirements if the notice was changed. To give everybody an opportunity from the public to speak on it, you should probably wait till after 7 before making a decision.
Do I hear any objections to that proposal? Great. So in that case, let's turn to trustee discussion. And I have a feeling it'll last more than 24 minutes anyway. Trustee Birma, yes.
I would like to, before we get too far into the discussion, there seems to be, from hearing some of the attendees speaking out, there seems to be some confusion about where it's required to wear a mask and where it's not required to wear a mask. And I didn't know if Attorney Cosnick wanted to just go over that briefly, just to kind of clarify what's in this ordinance and what we're actually asking of people before we got too deep into the discussion.
Can I jump in real quick? I think before we talk about the scope of the ordinance, I think we should talk about whether or not this board generally is in favor of an ordinance or an advisory or no action or some other option that I haven't just listed. I think that's the best place to start before we dive into the details of whatever the specific thing is, because it'll be very different depending on which direction this board would like to go. Would someone like to kick that off? Trustee Wiegert.
Thank you, Mr. Mayor. Yeah, I will begin with, first off, I'm not sure that I personally have had the opportunity to review all of the material that's been provided to me via email. In my profession, I don't get the opportunity to check email on a regular basis. I normally check it once a day in the morning. When I got off work tonight, I came home at 5:30, 30 minutes before this meeting was to begin, and I could see that there was 15 different forwarded email messages. How am I supposed to sort through that for a 6 o'clock meeting? I'm fully unprepared to make any decision tonight. And I wish that I can understand that these letters are coming in late, but I wish we would have a little bit better opportunity to review what people are asking us.
I'd like to just quickly address that. Those 15 emails, which we all received, for the most part, were one sentence public input responses about supporting or not supporting this ordinance. And I haven't finished that tally, but I believe that all 15 were against an ordinance, if that's helpful for you at all. Otherwise, the meeting packet link did have issues. I also had issues, but I called and was able to get an active link. And I believe that they reactivated the link, and we all had at least 2 days to receive the 3-page packet. So I'm not sure that that's entirely the case that you don't have the ability to engage in this discussion today?
With all due respect, Mayor, it is. I work with my hands. I don't have a smartphone. I have a flip phone. Okay. I do not get email messages as soon as they come in. All right. I would like the opportunity to read each one of these for my own and not just have to take the mayor's word for it, please.
I appreciate precision, and I would ask that you please try and control your emotions and speak with a little more professionalism. Thank you. Trustee Harper.
Thank you, Mr. Mayor. I too agree with Trustee Wiegert. I was unable to open up the tab that was attached to the email, and I didn't get a newer one until mid-morning today, Monday. I was able to see everything. However, I do want to also agree with Trustee Bierma. I think we need real definition from Attorney Kosnak when we do talk about this, to see what line by line the true definitions are. Thank you.
Thank you. It sounds like we have a few issues for you, Administrator Ryder. Trustee Barilla.
Okay, hopefully everyone can hear me. I have quite a few issues. Going back to what Mr. Zimmerman said, the same thing happened to me while wearing a mask and working. I literally slumped against the wall, lost feeling in my face, lost feeling in my hands. I'm very glad that Carrie Metzler was walking into the room to deliver some material for me for opening when this happened. And that's just from the working standpoint. So going at it from the standpoint of everything I have read and the number of constituents that have reached out to me with amazing amounts of trepidation moving forward with this, I feel that it's somewhat inappropriate for us as a board to be even doing this. I believe that a strong worded advisory from the health department is all we would need. How come we have made it through all of the COVID based on public health giving the inputs through the OEM, and now all of a sudden we have to make an ordinance? So I am definitely not in favor of the direction this is moving. And there are quite a few holes in the ordinance that we received. It doesn't talk about how enforcement is going to happen. It does not address any of the, oh gosh, I lost it. I lost my link, hang on. The signage required, who's actually going to develop the verbiage and the signage, and then general information for all persons pursuant to the Federal Centers of Disease Control guidance. The public is only strongly encouraged to wear it. Yet we're going to say that it's even though in the ordinance that's written right now, it's contradictory, because we're going to say they have to wear it, even though it says it's only strongly worded. So there's some really big holes in the what I see in the actual ordinance. So somebody else can take the floor. Thank you.
So we're a little, I feel like we're off track and jumping the gun at the same time. So I'd like to reiterate what I said before, which is that I don't think we're making a decision to approve or not approve this ordinance at this moment. I think this board, because of the hasty nature of this meeting, first needs to discuss what direction it would like to go. Do we want to consider an ordinance at all? Do we want to consider an advisory, or do we want to not act? And so that's the discussion I would like to point us towards first, because I agree with all of the critiques of this particular ordinance that I've heard from others, as well as Molly just now, Trustee Barilla just now. So I think before we talk about anything specific to that document, we need to first decide what direction we'd like to go. Because I have a feeling that whatever we decide, even if we decided to go towards an ordinance, it wouldn't be that particular one as drafted. So does that help guide our discussion at all, or do we still feel like we're not able to have this discussion? Trustee Barilla? I
think I covered every single one of the talking points, including the latter. So I voiced my opinion that I think it just needs to go back to the public health department.
Thank you. Trustee Lashley.
Thank you, Mayor Furman. To address your question directly, I would be more in support of a public health advisory than I would be an ordinance. I think that there are a lot of great benefits to wearing masks in our community. Personally, I just found out today that I had tested positive for antibodies and have had the coronavirus at some certain point, but for the protection of the general public and my staff, I think that it's an important thing that I will choose to continue to wear a mask. As far as our obligations as town trustees, I feel that not being certified health professionals, it puts us in a difficult place to enforce an ordinance, especially the ordinance that we've seen in front of us. I worry about enforcement issues. Our sheriff spoke pretty clearly that he said this was an ordinance that he would not be able to effectively enforce. But I am in favor of utilizing some of the resources that we have in this community to encourage people to maintain social distancing, to encourage people to wear masks. And I feel that a public health advisory makes this less divisive in our community, and it encourages, and hopefully we can accomplish some of the goals of mask wearing through social pressure, normalization of wearing masks. But I think that going the route of an ordinance further divides the folks who are supporting wearing masks and the folks who are supporting not wearing masks.
Trustee Berla.
Slightly different issue. Sorry, my phone has been blowing up. There are quite a few people who have sent me messages that they can't even get into this Zoom to even put in under the attendees list to even ask for things. So can anybody explain why we have constituents out there that are not able to get in? I don't quite understand, and it's coming at me, so I said I'd address it really quickly.
Thank you. Lisa, yes.
Yeah, I'm working here on the back end trying to figure out what's going on. I've also heard from several community members that are having a challenge getting into the meeting. I personally had a challenge getting into the meeting when I first started it. So I don't know if it's something in our settings or if it's something on the Zoom platform. I have heard people talking about it crashing on them recently, I think just because it's being so heavily used. We are live streaming to YouTube right now, so folks can at least hear the conversation, even if they can't participate with a comment. And I am trying to figure out how to fix that problem as we speak.
Thank you.
Mayor Pro Tem Barney, any thoughts?
Sure, Mayor, thank you. I guess I've spent a lot of time thinking about this issue and over the past couple days and trying to be out in the community and hearing what people are saying and trying to kind of do what Becky said too, hear from people who may not feel comfortable speaking up or who have maybe are part of more of a vulnerable population. And I just want to lead with, I'm so conflicted. I think this is a very challenging issue. I think it's hard for us to make a decision from a place of unity when we have really different perceptions of risk. I've been thinking about backcountry skiing a little bit, like trying to go out on a day with a backcountry ski partner where I think that the risk is extreme and my partner thinks the risk is low. and trying to decide what we're going to ski that day from a position of like a real disagreement on what kind of risk we're taking on or how willing we are to take risks. And so I think that's partly where I'm worried about making decisions like this, because we're coming at it from a really different perception and analysis of the risk. And I'm very compelled by the evidence that masks are effective. I hear that 80% participation really with social distancing and hand washing works to eradicate the virus, or, you know, push it out of the community, at least flatten the curve. And so where I land with a lot of thought is with a question, which is, I want the most number of people in Silverton to comply with masks, to wash their hands, to be socially distant, to take care of each other. And I want to know, what is the approach that will encourage the greatest number of participation in keeping our community healthy? Because we sit here in such a privileged position of health. And I think the second we're sick, or the second we see a loved one sick, or we have a loved one to worry about, I think we realize just how important our health really is. And so I just think we're lucky to be healthy and to have this decision to make. And I'm not exactly sure what the answer is to getting the most people to wear masks. And I it's a question that I'm having. And I also wonder, and we have a lot of participants tonight, and we can't maybe ask their input at this point, but what would get a non-mask wearing person, someone really adamant about not wearing a mask, to wear one? Because I think there's just so much evidence to suggest that that's going to keep us safe, and I think healthy, and that means open for business, because a sick community is a closed community. And I also have a question about how urgent the ordinance is. I don't know, like, why now versus a month ago versus 2 weeks from now. I think it's a really difficult position to be making a political decision about a public health issue. Although, to go on a little bit, political decisions are made often to keep us safe and healthy. And like what Mr. Kham brought up about speeding and smoking, and those are really common examples of the way we make political decisions that interface with public health. So those are my thoughts right now. I'm really open. I think I'm really trying to attend this meeting with an open mind and to hear input from everyone to try to form the best decision for Silverton.
Thank you. Trustee Biermus had to stand up for a bit, and then Trustee Harper.
So I would agree with the definite challenges of enforcing this law. However, I am leaning more towards in favor of an ordinance. Just listening to our public health experts, I think there are public health experts for a reason. And if this is something that they're suggesting based on a lot of facts and evidence, that's something that we should really take into account. And I do kind of see it as being like a seatbelt law or a smoking law. Like, I understand that people need the ability to make choices about their own health and well-being, but this ordinance isn't about your personal well-being. It's about protecting others around you. I also think it'd be super important to put on a unified message for businesses I think it could get a little confusing if some businesses don't have, don't encourage people to wear masks and others do. You're putting a lot of pressure if there's business owners who have, who are more at risk because they don't have any way, apart from telling someone that they're not going to serve them, and they're at risk economically like everyone else is at, and then they don't want to turn people away. And if they're not wearing a mask, it's going to be hard to turn them away or, have any way legal means to do that. And, it could put other business owners at risk too. It would also have us unified with the counties around us. Durango has similar ordinances. Telluride does. Uray has a meeting tonight, from my understanding, and I believe Montrose has one coming up too to pass similar ordinances. So I think the more unified we can be during really challenging times is going to benefit us. And I think it's just a high, from my outlook on it, it's just a high risk scenario if we don't have mask ordinances. Maybe we become a hot spot and things get shut down, or we have to go back to being more shut down, and that could impact our economy even greater than maybe getting 5 to 10% less business over a longer period of time. It just seems like the return on investment is greater. Having an ordinance, especially an ordinance that we can reevaluate on a timely basis, and it seems like that would be the case just as things develop to reevaluate this. Yeah, and if anyone else wants to add anything else in, I think that's what I have to say for now.
Thank you, Trustee Birma. Trustee Harper and then Trustee Barella.
Thank you, Mr. Mayor. My question is actually to Trustee Barney. It sounded as if you, like Trustee Wiegert and myself, needed a little bit more time to speak to your friends and neighbors and to those around the community.
Are you asking me if I need more time?
Well, it just sounded as if you wanted to gather more information and get the opinions of those around you. That's what it sounded like.
Okay, thanks, Trustee Harper. I did work really hard this weekend to attempt to gather that information, and I think I could probably do that for the next 2 weeks and still be left with a really difficult decision to make.
Thank you.
Trustee Barella and then Trustee Lashley. You're muted.
muted.
Did it click this time? Okay, so if you're a business owner, you would have received this packet. This is already a very strongly worded recommendation. My mask protects you, your mask protects me. Thank you for following the state recommendations and wearing a mask. It's both in English and in Spanish. It's already been distributed if you're a chamber member. It came out. These were done by the San Juan Public Health Department, or San Juan County Health Department, I think is actually what it says on the top. There are tons of information packets already ready with a very consistent message all the way through. And I just really want to know how I'm going to have my student or a child who's a busser telling an adult male who's 3 times his age that he needs to go and put on a mask just to stand up and walk 2 feet to go to the restroom. So I do have a lot of concerns about the way the enforcement would go, but we have already an amazing set of documents produced by the county health department in cooperation with all of the businesses in the chamber. So we already actually know where we're supposed to do, what we're supposed to do, how we're supposed to ask, how to be pleasant and polite in asking. We as business owners have to wear them in order to be open. So if we're protecting ourselves already as business owners, although be careful which mask you wear, I will tell you from personal experience, I thought I was going to be carted out in the ambulance. We've got enough in place. So if we ask business owners to just enforce what's already in existence and the propaganda and material that's already out, we really don't need to actually say this needs to be forced upon individuals coming, because we've got people coming in from all different areas. Some of them, their states have been open for a month or more. So how is that pushing backwards for them? And yet we've had several months with, yes, it's good, no, it's bad. I mean, I can read you a CDC link that I was sent today that I hadn't even noticed before that said wearing masks, the efficacy was only at 0.08%. So we have so many conflicting information out there. Why are we trying to force this on people? If we make it a strongly worded suggestion rather than an ordinance, then we don't have to worry about enforcement. It chalks itself up being personal responsibility. If you choose to wear it, just like Scotty Peterman said, she and her husband and her family are choosing to wear it in all public spaces. And they own a business too. She's going to follow the same rules and guidelines that I was given. Thank you.
Thank you, Trustee Rilla. Trustee Lashley, you had your hand up before.
Yeah, thank you, Mayor Furman. I just wanted to kind of echo how difficult a decision this is to be made, and how I could sit and talk to members of this community for another 2 weeks and still be left with a difficult decision. So just because this is a difficult decision doesn't mean that, at least I personally feel, that I'm lacking the information in order to make this decision. I feel like I'm very well informed for this conversation, and that's what we're here to do, is to talk through some of these difficult positions and difficult points in this decision. I do, ultimately want to say that my personal feeling is I want to encourage as many people in our community to wear masks as possible. I think that it does help reduce the transmission and the spread of disease. Around 50% of our population is elderly over the age of 60. I am concerned about their health in our actions today. As many times as I've heard the argument that people are not going to be able to come to this community, or will refuse to come to this community if we do have a mask ordinance, I think the alternative of shutting down our community because we did not have something in place that encouraged mask use and we have a massive outbreak could be negative, far more negative than than those who are very vocal saying that they won't come. I do worry about the protection of the workers in our community more than just my own employees. I'm worried and concerned about the other employees and workers who may not be in the same position as having the same type of guidelines followed that I think the majority of businesses in this town are really striving to maintain here. And then yeah, I just think it's important that we really do encourage people to wear masks, and we encourage people to engage in appropriate social distancing. I'm just not convinced that an ordinance is the best way for us to get there.
Thank you, Trustee Lashley. Trustee Bierma.
I guess this is more of a question posed to Judge Edwards or Attorney Kosnick, but is there or could there be any liability issues as far as whether or not we have a mask advisory versus a mask ordinance, and whether or not someone was to knowingly have coronavirus and choose not to wear a mask, or or anything kind of similar to that? I know that might be out of your realm of law, but just thinking about those type of things.
So what you guys are considering is a legislative policy decision here. Whether you adopt it or not, there's no legal ramification and there's no increased liability based on your decision tonight if you do not go the way of an ordinance. So it's policy decision in your court, and you shouldn't really base any decision on potential liability for not adopting something.
I've just been updated by Lisa that on YouTube, because of the technical difficulties we're experiencing allowing attendees on Zoom, we do not normally monitor comments, but we are going to this evening. And so comments are turned on YouTube. So for any participant that's watching, I do believe there is a meaningful delay in the video on YouTube. So Lisa's going to monitor those comments, and then at some point relatively soon, we'll reopen a comment period where Lisa will provide the comments from YouTube. And if any attendees who have joined this meeting on Zoom since 7 o'clock would like to comment, we'll also open up to them. And I think it's also important to note that we're still transitioning to all this technology, and the town apologizes for these technical difficulties and will continue to do its best to make sure that we're able to provide everyone sufficient access to these meetings and ability to comment. And we appreciate your patience as the town works through these difficulties. Trustee Barilla.
Okay, is it unmuted? Is it working? Okay. So I just wanted to make sure, Lisa, I know, Lisa, you saw my comment, but have you posted it anywhere so that people know that they can comment other than just listening to what the mayor just said?
In process.
Okay, thank you. Yeah, because that way I can kind of pay a little bit more attention and have my phone stop blowing up today.
Yes, I will get that taken care of in the next couple minutes here.
Thank you.
Trustee Lashley.
Thank you, Mayor Furman. Just wondering if we should be monitoring the YouTube stream as well for these comments, or if there's some other way for us to see them.
If I may respond, that is where I am looking for those comments. So I will post to the town Facebook page to let the folks who have been commenting there know that they can comment on YouTube. It would make my life a lot easier if I didn't have to juggle multiple platforms for commenting. So let's funnel folks to YouTube, and I'll let people know that that's where they should go for that.
Trustee Birma.
Just one other comment that kind of came to mind, thinking about our neighboring counties' ordinances, and maybe Trustee Harper would like to speak to this too, but you know, there could be some, just thinking about like people coming up from Durango on the train. A good chunk of our tourists come from Durango, and if they have a mask ordinance, what does that look like when they come from Durango on the train up to Silverton where there's no mask ordinance? But I guess just another thing to think about.
Sir, are you directing that question to me?
It's not really a question, more just a comment, as you know, something to consider as we move forward with this process. And I don't know if that was something that you'd given thought to, since you kind of are straddling both Silverton and Durango at times.
Trustee Burma, thank you so much for the question. Honestly, I don't want to speculate on that at this time. I'm sorry. Thank you.
Trustee Lashley, and then Mayor Pro Tem Barney.
Thank you, Mayor. I tried to do some research too from some folks in some of our surrounding communities as well. This weekend, I reached out and was able to talk to several visiting friends from Durango and Uray, and one couple from Montrose. My kind of feeling as far as the Durango ordinance is, and we have a copy of that ordinance that we were delivered as part of this packet, is that the Durango ordinance is more or less an educational ordinance. So there are not necessarily specified fines and fees, although it does allow enforcement to be made after several attempts to kind of correct behavior. But I think the consensus that I got from people that I know in Durango is that it was about 50-50, depending on where you went, which is about the same amount of compliance that they had before the ordinance was passed as well. I was actually present in Durango the day that the ordinance went into effect in Durango, and saw that pretty much for myself firsthand, that outdoors there were some people who were fearful and putting on masks, and then in certain businesses there was absolutely zero compliance, and in others there was complete compliance, and then a mixture in the most populated locations like the grocery stores and things. Ouray, I just received a comment from a citizen who said that they felt that the advisory and the Ouray had been doing its job well, and that 98% of the people there were more respectful of mask wearing. That was also the feeling of one other person that I talked to from Ouray, who I saw yesterday as well. And Montrose seemed to be kind of a hit and miss, but I think that at least it sounded to me like a lot of the businesses there were at least encouraging and participating in mask compliance as well. And I just was curious if any other trustees have any experiences to share, or any staff members for that matter either, as far as how this has gone in other communities, and how they think this is panned out for communities that have already engaged in this discussion.
Mayor Pro Tem Barney, did you still have a comment?
Thank you, Mayor. Yeah, Trustee Lashley, I'm hesitant to, it's so hard, we only have anecdotal data on compliance. And so I've heard all ends of the spectrum on compliance from other communities. So like Durango implementing an ordinance, kind of what you're saying, did it affect it much? Montrose, what's the compliance in Montrose? My experience being there today was pretty different than a friend who was there yesterday. And so, I'm trying to think like what motivates people to wear their mask. What, is it the threat of a punishment, or is it trying to care about a community? And like, how can we best generate and create a culture of compliance with, like what Trustee Barella was showing us? I think those graphics and those materials are part of a really, multifaceted presentation to the public on how we put our, how do we promote health here? What is it, how do we share that with the people who come here? Because while we've been doing a great job in our community, has stayed either sick and returned to health. We haven't had any deaths, and we continue to stay really healthy. And we've complied with a lot of the guidance that we've been working with to this point. But we're just about to have so much exposure and of people who are coming from other communities where the guidance has been lifted for a lot longer than here, and so I think our exposure will increase. And I guess it's uncertain. Typically when we're uncertain about what can possibly happen in the future, I prefer to be prepared for uncertainty rather than unprepared for uncertainty. And I'm just really concerned about the division, the social division that the mask decision is creating in our community. And I think it's a real, problem. And I think it's really emotional for our community. And I think, if this was a medical decision alone, it seems really easy to me, but it's just not a lone medical decision. We have economic factors that we're weighing. We have decision fatigue. We have, really, really highly charged feelings on this subject. And so I think no matter what we do, I want to be mindful of the division that I'm sensing in our community, and how we want to address that, and how to work together to keep ourselves healthy.
Thank you. Yep, go ahead.
Sorry, one more thing. I've also heard a lot about the enforcement, and I think we should take a concerted effort to somehow address this. And I don't know if Mr. Kosnick can kind of help us with this. I did hear, and I do see the idea of our children in our community having to face off with somebody who's being belligerent on this issue. I think we want to set ourselves up for success here. I'm hearing that concern. I would like to know that we wouldn't put a young person in that position. And I'm wondering about, is that really suggested in the ordinance, that is how we would be enforcing this? Because I think it's important that we don't put young people in that position, or anyone for that matter, who's not comfortable enforcing a public ordinance. So I think we should open up the subject of enforcement.
Trustee Bro.
Directly to your point, Sally, it's not clear in the ordinance about that. So I think most of what we heard back today from business owners was that I'm not going to be the mask police. Get away. Don't even talk to me about that. How do you want me to approach that subject? Is the signs and everything else not enough? It chalks itself up to individuals. This is your right to wear one, and I pick somebody, whoever's right not to. So if we try to enforce it across the board, how are we going to do that? How am I going to really tell all of my employees, or for that matter, Trustee Lashley or Trustee Harper or Mayor Furman, how are you going to tell your employees that this is your job now, regardless of your age, regardless of your ability, regardless of your fear? You have to be the enforcement now in your business, and then you've got to call whoever it falls on to. Say it falls on to Billy Mack, so then we got to call Bill Mack on the phone and say, well, I've got a belligerent customer who refuses to put on a mask, and then Billy Mack pulls him outside because he doesn't have any arrest powers or anything like that, and goes to write him a ticket, and then they refuse to give their name and address, and then the next thing you know, we're at an escalated level, and you've got to bring in the sheriff's department. I mean, these are questions that I have fielded all day from other business owners, and the way that they feel that the round robin of enforcement would go. So I don't know how Durango is even coming to grips with enforcement, especially when you're causing a $300 fine. That is huge. If that's still what it says, I don't know if we've had a different version, but where are we going to do that from? What position are we going to stand in and say, okay, in my business, I am now the tax collector for the state and the city and the county, and now I am the mask police for the town of Silverton, and now, I mean, the list just is compiled on. We have a lot of regulations already, regardless of what industry you're in. I just don't see how layering another one on by an ordinance, let me make that clear, I'm saying by an ordinance, is helpful to us. If we just ask for an additional mandate through the OEM and San Juan County Public Health, then we're putting ourselves into the correct position because we don't even know. We might get data in another week that says, don't wear masks. I mean, it's been so vacillating all of this time. The positions that we're in, we don't know if we're coming or going on some of this. So I think it's personal responsibility. If you want to wear one and you ask your customers to do so, I've had no problem asking customers to do so. It was very generous. Administrator Ryder and Town Clerk Freeze were walking around distributing masks. And I put a big stack right there based on the way I'm allowed to run my business now. I had no problem. People would say, do you have your mask? Are we required to wear one? I would say, technically it's only advised. They'd say, oh, well, sure, we'll take one. So if we make it a law though, are we gonna have that same sort of, niceness coming out of people? Does that make sense? Because you're then forcing them to do it rather than saying, hey, guess what? I have some for you if you'd like it. And yeah, thank you.
I'd like to take my moderator hat off for a moment and put on my participant hat. My concern starts with the idea from a policy perspective of adopting anything that we don't have a likelihood of enforcing or an ability to enforce. And from the last Zoom meeting, there have been so many, I forget which one it was, but Sheriff Conrad was asked directly if he had the bandwidth to enforce an ordinance related to masks, and he said absolutely not. But he did recommend the ordinance in order to see a greater number of people using masks. I think, I tried to frame the beginning of the conversation as how can we see the community adopt mask wearing as a social norm, but I don't think we would be setting good policy to create an ordinance that we don't intend to enforce, because that puts us in a position of picking and choosing between which ordinances and rules and laws we think are important and which we don't. And does that mean we do the same thing with respect to liquor laws? Does that mean we do the same thing with other civil or safety related laws? And so I think that's a challenging precedent to set in terms of policy. Durango, I think, dealt with that in terms of compromise by saying this is a voluntary compliance ordinance and it does not include any financial penalty or other specific penalty listed. And then the question is, whether it's an advisory or an ordinance, does it really make a difference if there's no penalty or enforcement anticipated or expected? And from my seat, I don't really see how it's different between calling it an ordinance and calling it an advisory. But the only thing I do feel strongly about is that we don't create a rule and say it's a rule and then say, but you don't need to follow it. Because then I think that calls into question our other rules. Trustee Brella?
So back to your point about calling it an ordinance or calling it whatever. You have two different issues going on here. We are a governing body of which we were elected by the constituents of the town of Silverton. The other one is the public health department. So that's two different things. Everything else we have done have been coming out from Jim and Becky. And so I don't see how them not continuing on the path and the course that we've already utilized for the last, 2.5 months. Why is that a bad thing? Why do we need to actually use us as a governing body to create this as an ordinance? If everything that the public health department has done and has worked so beautifully so far, why are we trying to push it to a different level? Because those are two separate things. Us as a body making a decision on this and having it become a legislative decision versus a health ordinance, because that legislative decision, like I said, it could be a week, it could be 2 weeks, it could be 6 months, it could be a year. Then it has to be removed. So if we continue on the path using the method that's been in place since the 14th of March and having the people who are in direct contact with all of the state, the state health department, they're the ones who gets the information a whole lot faster than we do. We find out a day later and $1 short sometimes that another policy has changed, or another health order has changed, or another decision has changed, and they're in the thick of it. They get that information probably every single day. At least it has been coming that way to them. So why are we trying to legislate what they have information on? Thank you.
I think that's a great question. That's something that has definitely come up in discussions with the town as well. The feedback that I've received on that topic is that it seems that all of the surrounding communities are trending towards providing the decision-making authority back to the town from the emergency management team. I suppose to kick the question back to you and the rest of the board is, do we want to push it back? And I personally was eager to be part of the decision-making process with respect to these things, as opposed to being a passenger on this. We've seen decisions dictated to the town over the last couple of months, and they've all been very controversial. And I'm grateful that we weren't entirely, responsible for having to make those really challenging decisions. And now we're being asked to make one, and we certainly could say no. But I think that having this group that that's elected and represents this community, be able to have these discussions and come to a decision about what this community wants with the guidance of the OEM team and the public health director is a good thing. My sneaking suspicion is if we kick this back, we're more likely to see an ordinance. So if this board is looking to not pass an ordinance, then it would behoove us to make a decision. But if we like the way things have been going and we don't want to take on this responsibility, we certainly can say so. It seems that the county commissioners did that by suggesting that the trustees make this decision, and that they didn't go ahead and adopt an ordinance themselves, which I think they also had the capability of doing. There are other counties where the county adopted the ordinance, not the town, such as Boulder County. But that's all food for thought for these trustees.
Mayor Furman, I could address that piece just on the kind of transition from the incident management team decisions back to both the town and the county. This has been such a extended event, just with the time involved. We've really been very careful not to just come across as basically a small group that's just solely making the decisions. So that's why we actually, as a team, really wanted to start transferring the decisions really back to the elected bodies, while we're providing expert advice. So the discussion tonight has been really, really good, and I think very important, because in some ways you all now see just the important the key decisions we've had to make really on a daily basis throughout this entire event. The one thing I really want to emphasize is with the public health department and emergency management, our whole goal is getting community buy-in. It's very good for us to have these discussions, but what we really want to see is that community compliance with all of these measures. So it's not just masks, it's the social distancing, it's the hand washing, it's all of these measures. And if the community doesn't basically follow these measures, then we have to kind of go to that next step of doing more of an order or something a lot more strict. So I'll just leave it at that, and just here to still listen to the discussions. Thanks.
Mayor Pro Tem Barney.
Jim, can I I'll ask you a question, and if you can't answer it, that's okay too. What, do you have a sense of how much compliance, the percentage of our population is complying with social distancing, masks in particular, and hand washing at this point? Like, where are we with nothing? And then I have follow-up question to that.
Okay, that's a really excellent question, Sally. And I'm gonna just, what we do go in, we go and observe and see, just try to do little tallies. We haven't done, I would say, a full scientific study just to see. But what I can tell you is, with all of the calculations, the School of Public Health at University of Colorado has been doing epidemiological models throughout this whole event. And they base all of these calculations basically on 65% compliance. And that's what we're looking for. So when we're out there, if it drops below that, we as a team need to be very concerned about that. So it's, pretty easy to just do an eyeball to see if it's, 50% of the people are wearing masks or 50% of the people are cooperating. If we see that, then we really have to step up our education efforts, and then also the public health orders. Does that help? I hope that helps answer.
So Jim, would you say Silverton is at 50% compliance right now?
This would just be a personal estimate because I don't have good numbers on it, but I think it's actually been over 50%, just what I've noticed walking around. Masks in particular, I think that has been a controversial thing because it's been an education piece for everybody. But I do say with the grocery store has had great success at encouraging patrons to come in, and by offering a free mask, they've gotten really good compliance, basically. And to me, that's what we want to see. We want to see compliance. We don't really care about a fine or a ordinance. What we want to see is that compliance. That's an example.
Okay, so I have a quick follow-up here, if that's okay.
Yeah.
So I'm just thinking, like, again, back to my sort of my original question with all of this is how many percentage points of compliance we get out of an ordinance versus an advisory. So like if an ordinance, if there is some math on this, if an ordinance were to take our 65, take a 50% compliance rate and edge it up 20 percentage points, that sounds really good to me. If an ordinance were to be so divisive and so something for people to be against versus hop on board and be comfortable with, then we may expect to see at best a 50% compliance rate, and that would be sort of worst case scenario. I also see kind of another worst case scenario would be to implement an ordinance where we're at a 65% compliance rate and it just inflames the community and we dip in compliance and we lose percentage points from that. And then that would be totally defeating the entire purpose of the whole thing. And so, and I think because masks are visual, I'm not going around smelling people's hands to see if they've washed them. I can't tell who's washed and who hasn't. And, masks are such a visual display of compliance that they seem potentially, they have the power to be like a real model of our commitment to health and a real display of our community pride in our efforts that we've made for so long, and saying like, this is paid off for us, we're healthy. But they've also got the power to be so divisive and so so that people stop wearing masks not because they disagree with the health advantage of a mask, they disagree with the principle of wearing the mask. And to me, that's a huge loss as well. So I don't see that as a very good option. And I guess I also want to kind of get to your point. So I'm trying to think about it mathematically. Where do we get the most percentage points? And I'm wondering if you have a sense of, do ordinances, like, have we seen data that we can use to indicate how much an ordinance pushes us one direction or another? That was a long
Yeah,
follow-up, long-winded
those
follow-up.
those are all great questions, Sally. I don't know anything specifically with an ordinance, but I do know with the public health orders, you know, they are big fines. You know, the state public health order violating that, it is a big deal. So you know, and I think we have gotten good compliance because people do know it's like, oh, this is the real deal. They are very much meaning it. So I think if you do have basically a law that you need to back it up, it needs to be something very, you know, weight behind it.
Thank you, Jim. I'm sorry to also, Becky, I just realized you're also on the call. I didn't mean to push your expertise out. I just don't see your face. So it left my brain. And Jim, you mentioned the grocery store, and I'm thinking about that as a model for our businesses. It sounds like a bright spot. Like, if that's working, how can we replicate that model all over town? To, if that's working, let's do what works. So I don't know if we can talk about that more either, but I know I'm.
Yeah, I totally agree, Sally. I think that's why we wanted to actually have this discussion and not just have it as our incident management team, because we do feel like this is a community decision. I do have to say that an ordinance provides protection to people who may not be as that, you know, they don't want to get in an argument with visitors. They can just say, hey, this is the ordinance, you know, complain to somebody else. I'm just trying to follow my town ordinance. So that's where I see the advantage of having an ordinance. But yep, Ms. Barella, I'll answer your question now, or Becky's on here too, so she can jump in.
Trustee Barella, you're muted again.
Now that time it was me. I don't know if I was first or if Trustee Burma was first. He had his hand
And
up.
Trustee Wiegert.
You can go ahead, Molly, or Trustee Barella.
Okay, so I'm still receiving tons of messages because people are not figuring out either how to comment, or it appears that the comments kind of work but don't. Anyway, so this is my message. I can't figure out how to comment on YouTube. I worked on Sunday at the visitor center. We were open, and I would have to say that 80% of the public was wearing a mask. And this is coming from, this message in particular, I promised I'd read, was coming from Carrie Metzler. So we do have, it's the same way for me. I'm not feeling any different. When I ask people to put them on, lead them to the table, they're more than happy to do so. And nobody's threatened with a fine. Thank you.
Thank you. Trustee Wiegert.
Well, this is a question for Mr. Ryder. I'm just curious how we're progressing with that $5,000 grant that we've just received and purchasing PPE equipment. And then my understanding is that that may be distributed amongst businesses with high use of protective equipment. Can you talk to that a little bit?
Sure, Trustee Wiegert. Luckily, the grant was for $10,000, of which we spent about $5,000. We secured 10,000 masks and 25 gallons of sanitizer. They come in 50 mask boxes. We've distributed 15 either by hand or people coming in. We're going to put, I'm probably going to write a town talk for this Thursday's paper. I'm not sure, Lisa Brand, if we've got the availability of those up on the website. We should do that, but just to put the word out that we do have them and they are available for distribution. So we'll see how those go. We're going to monitor how fast people go through 50 as we get ramped up here. and see if we need to buy more. But that's going well, and the businesses have been very appreciative of the fact that they can secure those and not have to go through the pain of securing them or buying them themselves.
So I'm assuming that all the businesses have been contacted and they're in the loop. They know how to get access to this kind of stuff that we have available for them.
In the process of doing so, we walk out, every day. It's been word of mouth so far, but we're getting ready to, broadcast more fully so that they know.
And that's something that every business in town would have equal access to.
Right now we have, remaining 185 boxes of 50. So we have plenty to go around, and we have the 5,000 more of grant money to buy more if needed.
So it sounds like the opportunity for some other businesses to model what the grocery store has been doing is out there, and look forward to seeing that implemented.
Absolutely.
Trustee Birma?
Yeah, I had my hand up before. I just wanted to reiterate what Sally had said. I love math, and I think it's super important to look at the numbers. And I think, looking at the math and statistics behind it, it helps takes the emotion out of the argument. And I think whatever decision we make and whatever works out best for us, I think we all have the same goal of keeping the most people safe while doing the most beneficial thing for our community. And I think we're all on at least the same page of that. And go math.
Administrator Ryder, yes, please.
I'm absolutely a math guy, and I just want to remind everybody that these programs, ordinances, and advisories for mask wearing have been out for about a week to 2 weeks, and we need to have some time pass before meaningful data is going to be able to be assembled and analyzed. So to get into the specifics of did an ordinance increase usage by 20% or an advisory didn't, we're way premature to have meaningful data on that. So just to level set everybody's expectations, we don't have 10 years of empirical data here. We've got a week. So it's going to take some time, to develop, and probably just gut instinct is going to be the first thing to see. We did the ordinance, we're observing this, we're deriving a percentage. It's not going to be highly scientific. So just to make sure everybody's level set here, that this is a very fledgling program, and having that kind of meaningful data is going to take some time.
Thank you. It sounds like we're still having some technical issues with commenting. I would ask Lisa quickly if she's received a meaningful number of comments that it would make sense to halt the discussion for a moment to hear those comments, or if we have, if we need to wait for that to be further resolved. Lisa, do you have a thought on that?
We have a handful of comments that have come in via the chat. Trustee Barilla was saying that somebody has said commenting is turned off. My challenge here is I don't want to tinker with settings that are going to interrupt the live stream. So I don't see where the issue is. As far as I can tell, commenting is on, and we do have comments coming in via the chat. So I can continue trying to rectify the situation. If we want to jump into reading the comments that have been received so far, we can do that. I am open to your suggestions.
Unless there's an objection, why don't we go through the comments that are there? But let's hear from Trustee Lashley and Trustee Birma very quickly. Trustee Lashley?
Yeah, just regarding the comments, I was trying to get some snapshots to kind of post on our own chat here that might help us kind of read through them. I don't know if it pleases the board to kind of see those comments themselves or to have them read aloud.
I would suggest that Lisa read them just so that they're equally available to everyone that's viewing on whatever platform and to us. Trustee Birma, did you have a comment as well?
Yeah, I was just going to add to that. I'm also following along on the comments on YouTube, and there's, I'd say maybe 15 to 20. There's only, I see one comment that specifically asked to be read aloud, and I'm not sure, how many other people want to, but maybe Lisa could read those off.
Okay, just one point of clarification. It's the Zoom webinar chat, I believe, that is disabled, and that is correct. We do not have that enabled for meeting attendees, only for panelists, because in the past when we have enabled chat for meeting attendees, that went off the rails. So we can accept public comment verbally from anyone who is in the Zoom webinar right now. Anyone who is not in the Zoom webinar but watching on YouTube, they should be able to chat, and that is where comments have been coming in. So I apologize, I'm distracted because I'm checking multiple windows and trying to make sure I'm not missing anything. I'm ready for instructions from the trustees. So I hear you guys wanted me to read the comments on YouTube.
I think that sounds like a good thing to do at this juncture.
Okay. I'm going to pop over there. Our first comment is from Katie Fetch. She says, I think a threat of punishment will discourage people from visiting altogether. If anything, issue a nicely delivered warning and a free mask. From David Breed, the comment is, from a practical standpoint, even if the meeting is legal or acceptable, given the notice and technical issues, it's not really best practice to be voting on anything tonight. From Carrie Coleman. Thank you for fixing things so we can comment. I appreciate it. I would mention there was the same issue with the last Zoom trustee meeting, and I am trying to make an effort to participate. It is frustrating. I am in favor of it. However, I am immune compromised, so probably am biased. I also own a business in Durango and Silverton where the ordinance is in place. I am most concerned that if this ordinance is put in place, what enforcement will look like. In Durango, the police department has a policy of educate, not enforce. They are politely reminding people of the ordinance, but not ticketing. I think there needs to be guidelines included on enforcement policies so people aren't scared to come here. Okay, next comment is from Rob Pincus. He's a volunteer reserve deputy for San Juan County Sheriff's Office. And he says, speaking as an interested party with a deep love for Silverton and this region, I believe the issue should be left to individual business owners. It is apparent in our county right now that people are tired of the enforcement of inconsistent and poorly explained restrictions and mandates. Educating and empowering people to make smart decisions freely seems a much better solution for a tourist destination, particularly one that revolves around an environment that requires everyone to accept risk and manage it smartly in so many ways. People who live and vacation in this region do not have an illusion of extreme safety, nor are they the type of people who desire a nanny state environment. We are the type of people who balance life, liberty, and the pursuit of happiness, not choosing one over the others. The next comment is from Matt Green. I think that an advisory would be a much better idea. One catches more flies with honey than vinegar. Personally, I have had a lot of success getting people who seem reluctant to wear a mask by simply asking nicely, saying something like, I have an immunocompromised family member, so while masks are not mandatory, I would greatly appreciate it if you wore one. So far, I haven't had any people, local or tourist, decline to wear a mask after I have asked, unless they literally don't have one. Then there's the issue of enforcement. This would be a lot more stress on our law enforcement personnel. I just really think that an advisory is a much better idea. Thank you for your time, Matt Green, 859 Empire Street. Then we have some comments from Trustee Lashley. And I believe that is all of the public comment that we have received on YouTube so far.
Thank you, Lisa, and thank you for everyone that provided comment. We appreciate your input. So would anyone like to make a suggestion of how we move through the rest of this discussion? Do we feel that it needs to be tabled? Do we feel strong enough to say no to the concept of an ordinance, or would we like to discuss an ordinance? I'm looking for direction from this board of what they would like to do so that we don't tread water for the entire evening. Trustee Lashley.
Thank you, Mayor. I'm seeing two pretty clear things from the public comment that I've received both personally and through kind of written communication via email, YouTube, and today. I'm seeing a lot of people who are really not in favor of us having an ordinance and passing an ordinance right now. And I'm seeing some public comment that is saying that they don't believe that we should be voting on this tonight due to kind of the circumstances around the technical difficulties and some of the other issues. I guess I'd like.
Which I think we defer to Attorney Kosnick and have to follow his suggestion as to whether best practice would say we screwed this up, or, and I'm using the global we, or if despite public sentiment, the process was followed and this should move forward. And I think he's the person to make that call. I'm sorry to interrupt, please continue unless you were finished.
That was more or less what I was thinking. I guess I was just going to at least agreement with the sentiment of most of the public that we've heard, that an ordinance is maybe not the most desirable way. Kind of echoes the sentiments that I've already expressed, that I kind of think a public health advisory or educational campaign that it doesn't involve an ordinance, I think would be more appropriate.
Trustee Harper.
Thank you, Mayor. I want to agree with Trustee Lashley. I do not believe that we've done our job correctly in allowing the public to comment. Whether technical glitches or not, they need, each and every one needs to be able to have their voice heard. And I feel that tonight they just haven't been able to have that for whatever reason. I think this does need to be tabled till next Monday, and I think we need to figure out what went wrong this evening and we can correct it and move forward. That's my comment. Thank you.
Thank you. Attorney Kosnick, would you like to give us direction?
Sure. So I don't know the full extent of the technical difficulties. I'm no expert in those matters. It sounds like there has been an opportunity to comment through the YouTube channel for folks. This is a legislative matter, so it's not quite, if this was, to a quasi-judicial matter or something like that, then there's a much stricter standard for ability to comment. So at this point, it seems, unless, please correct me if I'm wrong, there appears to have been a method to comment on the discussion tonight. And, so it now would be in the hands of the board to move forward if it chooses. I think the noticing issue has been resolved now since it's well past 7 and the public has had an opportunity.
Thank you, Attorney Kosnick. Well, with the myriad of issues we have, I suppose deciding whether or not to table this because of, even though it's from Attorney Kosnick's perspective, not a legal issue, from a best practice perspective, if this board wishes to table this, we certainly have the power to do so. If the board wishes to make a determination about not adopting an ordinance, which sounds like there are multiple people in favor of, we can move that direction. Or Trustee Birma, if you would like to convince the majority of the board to adopt an ordinance, then sorry to throw you under the bus, we can have that discussion, but those seem to be the options in front of us in order to move on to the next agenda item. Since I just threw Trustee Birma under the bus, I'm gonna let him go first, and then Trustee Barella, you're next.
No, and I'm more than happy to hear from everyone, and I want to do what's gonna, be best for our community. And I'm totally fine tabling this too. It seems like Trustee Wiegert and Trustee Harper, have made us aware too that they need more time to, make a really educated decision on this. And I know it's somewhat of a time sensitive issue, but I think we should give them that time to go over material and be able to, get educated and have a good opinion on this.
Trustee Barella, and then Trustee Lashley.
So I was gonna make a suggestion that we direct staff to look up possibly doing this more as an advisory versus an ordinance based on the information that Becky Joyce and Jim Donovan have been using in the past to move forward with this. And I will agree with the collective decision of the board this evening if they want to table this. But that is my suggestion in order to have a second piece if we go into a meeting next Monday and then we are fully prepared, because if we direct staff to do this, then we can have two different pieces to look at comparatively, go through and say, what are the finer points of each, and then maybe come to a better collective decision. Thank you.
Trustee Lashley and then Administrator Ryder.
Thank you, Mayor. Just a couple points here to share, not really necessarily a direction, but kind of some extras. This has been a really excellent discussion, and I want to thank everybody for participating in this. I've learned a lot from both trustees and members of the public as far as how to really talk to people about wearing a mask. I haven't maybe had the greatest experiences compared to some people here, but hopefully with a little bit of some of this input that can hopefully change. I also wanted to say that to the OEM team that it would be really, there seems to be a lot of questions about some of the testing that's been going on. And on our next meeting on Monday, if we could have a presentation, maybe with some of that information that might help us as trustees better make this this decision and have a fruitful discussion about that as well. If it's possible, I understand that you guys are trying to collect imperial data and you're doing your very best, but and thank you guys for doing an amazing job with the testing as well. But that might be an important part of the discussion on Monday if you guys are able to give us some more information there.
Let me just address that real quick. So the antibody testing is very complex information. So I'm not going to make any, I think we can provide information on the number of tests that have been done and also on the viral testing that has been done. But it just does need to be understood that the antibody testing, it is not easy to interpret. So we'll kind of play that just based on the information that we collect this week and kind of get more technical guidance on it as well.
Thank you.
Administrator Ryder and then Trustee Barella.
Staff certainly accepts Trustee Barella's challenge to come up with the advantages or disadvantages of advisory versus ordinance, but I've thought about this a lot and I've talked to my fair share of people in town, and either way, the goal is what? The goal is to get as many people willingly wearing masks as possible. I'm not going to express my personal feeling. That's not my job. But the one thing we're going to have to do with either direction is that what I'm calling now or thinking of as the 3 E's. We need to educate, we need to encourage, and we need to empower. I need to educate this person as to why it's the right thing to do to wear a mask. I need to encourage them to wear the mask, and I need to empower them to make the right choice. So I would also, challenge the board to think through that and keep in mind that the goal here is to get the most people wearing masks. And there's pros and cons of advisory versus ordinance that we'll have to sort through. I too appreciate the excellent discussion. both by the trustees and the public. It's a lot of food for thought. I would also like to apologize for the technical glitches. We are launching new platforms and going to new technology every day to try to make this all work better. And admittedly, they were glitches. We'll fix them. But I appreciate the opportunity for the public to fully weigh in by giving another week here. But anyway, let's think about how we educate, how we encourage, and how we empower, with the ultimate goal of getting the most people wearing masks. Thank you.
Trustee Barella?
So just another, because we keep asking for empirical data. And so this goes back to what Carrie Metzler said, because she's just having a very hard time, and she wants to make sure everybody understands that they have been keeping a tally at the visitor center, so that data will be available as you need it going forward from everybody working there. So she's actually trying to call me now, but I can't talk. So to her, I'll text her back. I know this is a very, very odd platform, and I really hate interrupting everything. But these folks contacting me feel it's very, very important that they are heard because they're not able to get on. So thank you for all of the extra leeway in this very odd meeting.
Trustees Harper and Trustees Wiegert, do you have concerns about taking Trustee Barella's suggestion to provide direction to the staff in terms of preparing some type of advisory rather than a full table and not providing any direction?
I think an advisory is a good idea, and I'm fine with that direction to the staff that Trustee Barella has made.
Thank you, Trustee Wiegert. Trustee Harper?
I too want to agree with Trustee Wiegert. Thank you.
Thank you. Does that require a motion to provide that direction to staff? Trustee Lashley?
Maybe finish that first. I was going to make a motion for tabling if that's the way we're going.
Gotcha. Would someone like to make, go ahead, Trustee Barella.
I just want to clarify that we are tabling the discussion of the ordinance, correct, Trustee Lashley? But we are also giving a motion to instruct staff to move forward on an advisory. Is everybody clear on what I had asked and said?
Mayor Pro Tem Barney?
Thank you, Trustee Barella. I am clear on the advisory. My question would be, if we voted tonight to support an advisory instead of an ordinance, would we revisit this regularly throughout the summer? Like how do we manage this decision-making process so that every week doesn't feel like this one?
My understanding, and correct me if I'm wrong, is that we would be directing the staff to prepare an advisory and that we're not voting to pursue an advisory, and that we'd have a formal decision next Monday between an advisory, an ordinance, anything else that gets recommended or suggested between now and then. And it would allow everyone time to provide further comment, as well as the trustees to feel fully educated in order to make the decision. Sorry, Jim Donovan, please go ahead.
Sorry, yeah. I think there just needs to be some clarification on an advisory would come from the Public Health Department, as would a public health order. An ordinance would come from the town. So the town actually wouldn't issue an advisory. I think that the town could basically do a letter of support for the county health department's advisory. Becky may want to jump in if she's still on there, and she could add in some more.
Yeah, I have been muted, so sorry I haven't really weighed in, but I'm following, and Jim's representing very well, and he's correct. I think you would absolutely want to do a public health advisory versus I would have to ask Paul if town even does advisories, but we would be happy to do a public health advisory if that's what you recommend.
Thank you, Becky. Trustee Lashley, then Trustee Birma, then Attorney Cosmo.
Just a quick question for the OEM team here. Difference between a public health advisory and a public health order, and whether we support, one versus the other.
Yeah,
So,
advisory is not an enforceable, it's just basically a suggestion. So that's what we did for the quarantine for people who were basically coming from some other location and being in Silverton, and that had an expiration date to it. Public health order is straight from Colorado state law and is enforceable, and that is, that's the sledgehammer that if we need to use it, we use it. And Becky uses it, I should say.
Trustee Birma.
I just wanted to do a quick little thank you guys for the super fruitful discussion tonight, and also from our attendees. And, it's just all about balancing risk management and economic outcomes, and the OEM team's job is risk management, and all the business owners want the economic outcomes. And I think it's just up to us to find that middle way, and I think we will get there.
Thank you, Trustee Birma. Trustee Burrell, would you like to make a motion? Attorney Kosnick had a comment.
I just wanted to comment on the difference. So what I was understanding from the board, when you were using the term advisory, that was more of a recommendation. And so that would be in the form of like a resolution. Jim and Becky are correct that officially titled advisory would come from the Department of Health, and that's something you can recommend that they do. But my understanding was you were just looking for a document that had a recommendation and not necessarily the enforcement, of an ordinance behind it, if that's what I was understanding.
Trustee Burrell.
So yes, I guess I did use the incorrect terminology. We've got so much floating around here with terms and advisories and this and that. It would technically be, we would advise staff to create a resolution, because the resolution then carries no fines, no fees. It's a cooperative document, I guess I would say. And it would be useful to have the input directly from the public health department and the OEM, I guess is how I should have actually stated it. So yes, thank you.
So would that be a resolution recommending the use of masks where social distancing cannot be maintained, but being very clear that there's no enforcement or penalty component of such resolution? Trustee Harper and Trustee Burrell.
If you're going to word it like that, why don't we just keep in place best practices?
And I'm just trying to paraphrase what Trustee Burrell is saying. I wasn't necessarily.
No, I understand. I'm not being combative. I'm just trying to. Sorry.
Trustee Burrell.
Yeah, I guess I wouldn't even use that terminology in this. You would just say, we, the town of Silverton, the Board of Trustees, have chosen to make a strongly worded advisement, however that needs to be said, in order to have all guests and citizens feel comfortable. I mean, I don't know the exact wording. That is what we're going to direct staff to do, but we don't want to actually sit there and go, well, guess what? There's no penalty, there's no fine, because we wanted to make it a strong advisory, using the wrong term again, to make sure that we do get our point across that, yes, we want you in our town, and yes, it is optional, but we do really hope you respect us enough that if we ask you to put it on, that you're going to. Like I said, I haven't had any problems. So yeah, that's That's kind of what I want to make my motion as, but if we need further clarification, I would defer to Mr. Koznick or Mr. Ryder to give my words better meaning.
Mayor Pro Tem Barney.
Well, and to address Trustee Harper's point, I'm wondering, I agree with you. Like, if we're gonna put a statement out there that is what already exists, then what are we doing? Is that kind of what you're?
I agree. I agree, Trustee Barney. If that's what it is, maybe we just put this up for a straight up or down vote.
Because I'm also hearing I don't know if it's just a few loud voices or a lot of people. It's hard to tell sometimes. This, you know, a question of where is town on this? Like, what is town doing? What is our leadership doing? Where is our leadership? So is that what we might try to address with a resolution, or does having a meeting about this and sort of hearing from the public help us guide and make our decisions stronger, and that improves our leadership? It's a question. I'm potentially a resolution from the trustees could support what we want to encourage in town and make a public statement about what we're expecting and guide people. I don't know.
If I may, it's pretty clear what town would like. We just bought 10,000 masks and 25 gallons of sanitizer. We are absolutely encouraging the use of the best practice of mask wearing. We're going to make that more clear via some communication this week, but make no mistake, town is encouraging the use of masks as part of the best practice package.
Thank you, Mr. Ryder. That's what I see and have noticed too. And I think if we're looking for a shift in people's behavior, providing them with those materials is probably our number one tool to do it.
Trustee Harper.
Thank you, sir. So then do we put this up to vote?
So it sounds like, I mean, your point before was that the public didn't have sufficient comment period, which I think would, even though this conversation is trending towards no ordinance and no advisory because we're not the proper entity to do it, it seems like your point about process, there was seemingly consensus about it a few minutes ago. Trustee Wiegert hasn't particularly weighed in because he didn't have the ability to get up to speed, but I'm trying to moderate to make sure that everybody has their input heard. And so it sounded like you didn't want to vote before, and it sounded like the rest of the board supported not voting. I'm open, but just wanted to reiterate that. Trustee Lashley.
I do have one more comment.
Please.
You're doing a great job.
Oh, thank you, Trustee Harper. Trustee Lashley.
Thank you, Mayor. I think, yeah, I agree with kind of those sentiments that we had fairly good consensus that it would be great to give the public an opportunity to be able to make their voices heard. I think they've told us that they don't feel like they have. If we could maybe just either make a motion or give staff direction to draft a resolution, I think that's probably where we're at, and then we can circle back to this next Monday.
Something I do think it's important that we do is that we do provide some communication to the community, whether that's a resolution or a letter in support of the OEM team to do an advisory. I think we've heard through a lot of the chatter and communication over the last week or so that there is a desire from the members of the community to hear the board's perspective. And I think that even if no decisions made tonight, that this conversation publicly was very, very helpful for people to hear, and quelling misinformation and rumors and concerns about, what additional rules and and enforcement issues they may face in the coming weeks. So I think that this was a productive conversation, and my view would be that we do communicate something in writing to the community, whatever form that is, that shows our support for the use of masks. And next week we can decide if that support is in the form of an OEM advisory or an ordinance, or we just would really like you to think about the 3 E's, but we're taking no action. And I think those 3 E's are wonderful. I really appreciate Administrator Ryder coming up with that. Trustee Barella?
So I'd like to make a motion to direct staff to create a resolution using the best practices from the health department and the OEM for additional resource, I guess is what I want to say, to make sure it's clearly worded and strongly advised.
Do I hear a second?
I'm so sorry. I don't have clarity on, there were people who spoke up in favor of an ordinance, and I think those people have a valid opinion too. I'm not saying that that's what I'm suggesting that we do tonight, but I'm not clear on what our plan is as we move sort of week by week into this. Like, I think it's not fair to leave it uncertain for the community about what is happening week by week. So how can we address that without having to revisit this over and over?
The kind of understanding I had of this is that staff would create this resolution, and then we'd have a vote, like an actual vote on approving the resolution or some other option a week from today. And then we would have to come up with some direction. I think we'd defer to Administrator Ryder and the OEM team on what they thought the frequency of revisiting this type of thing would be. I just guessing here, but I imagine if we saw some type of issue arise in the relative near future as town gets busier, there would need to be quick action one way or the other to figure out how to address those issues. But right now, if it seems that things are trending well. So making this decision next week would put us in a good place to reconsider issues as they arise. But Administrator Ryder, as kind of the person that's looking at all of this and responsible for all of the documentation and distribution of the masks and things, what do you think on this?
As far as
how we, how permanent is whatever decision we make next week? Do we need to include in the direction to staff or what is proposed next week something in terms of frequency in which we revisit or triggers in which certain events occur that cause us to need to relook at this?
The whole COVID thing has been a reactive process. So to set forth a set schedule of we'll revisit this every 2 weeks or every 1 week is a tough one. If the governor comes out and says, we don't need masks anymore and issues a PHO saying such, we have to evaluate whether we agree with that or not. So I don't want to revisit it every week, that's for sure. So I know Jim Donovan and Becky, they've operated in 2-week planning increments. So I'd say follow that.
Thank you, Mr. President. I'm sorry to have interrupted you, Trustee Barella. That was helpful for me.
Trustee Barella?
Okay, we have a motion on the floor.
Yep. Can I get
Trustee Barella, can you reiterate your motion so I can get it?
Oh, dear Lord.
Well, hold on
Is
one
it
second.
just a minute? Just a minute.
Kelly, were you able to capture what Trustee Barella said? And if so, would you read that back rather than asking Trustee Barella to do it by memory? And if not, I apologize, Trustee Barella, you may have to do it by memory.
Had direct staff, make a resolution 2, and then I got cut off or got distracted. Sorry.
And Kelly, you or Lisa don't have it either. I suppose, and playing back would be too hard. I think Trustee Barella, you might just have to do it again.
I don't even remember what I said now because that was so long in the conversation ago.
Well, I think we're directed. I think the whole idea was to have staff, create a resolution for the board to consider that would, recommend to the Jim and Becky group to create an advisory reflecting what we have in that resolution. Best practice map that we're strongly encouraging. We'll figure it out. We can always play it back. It's okay.
There's another thing I'd request that before this goes into minutes, we just play that back and get that word for word.
Yeah, I would agree with that because I wasn't quite sure. I thought I wanted Jim and Becky to be in on the conversation. So if we have to put out a resolution as well as something from the health department, that we've got one unified message. So, or if it just becomes one from either the resolution or something from the health department, at least we have one unified voice is what
If I understand, we'll create a resolution making a request of the public health office to create an advisory addressing these items regarding mask usage and best practices regarding mask usage.
Thank you. Trustee Lashley.
I'd like to second Trustee Barella's motion.
All right, thank you. Roll call, please.
Can you hear me?
Yep.
Okay. Trustee Barella?
Yes.
Trustee Harper?
Yes.
Trustee Wiegert?
Yes.
Trustee Bierma?
Yes.
Trustee Lashley?
Yes.
Mayor Pro Tem Barney?
Yes.
Mayor Furman?
Yes. Thank you, everyone. I believe that's a good step in the right direction. So we move along now to, if we all recall, we had a recommendation to consider a bunch of other potential ordinances, and the other two
Yeah.
items were.
Sorry to interrupt. Trustee Lashley has his hand up.
Yeah, I saw that. The other two. Yeah, go ahead.
Sorry, Mayor. Just as a quick point of clarification, do we also need to make a motion to deny the ordinance in front of us?
I understood this to be a tabling of that decision until a week from today.
Okay, if that's okay, that's fine. Yeah.
Because I think similarly, even though things seem to be trending against it, and we heard more comment against it, the idea to provide the extra week was to provide more time for people to educate themselves and to comment.
Sorry, just a point of process and clarification. Thank you.
Thank you, helpful. So the other two discussion topics relate to using outdoor street dining and open container, or using outdoor streets for dining, and then also considering open container changes. I know that we've got Judge Edwards in the meeting to help us understand some of the ramifications related to changing the open container requirements. And I believe we also have John Seitz on the line to help us understand the logistics, complications, or costs associated with making those changes. And then similarly, we have a discussion about converting Green Street to one-way traffic and figuring out how to do a one-way loop through town. So I will turn this over to Administrator Ryder to lead the discussion and about these topics.
So thank you, Mr. Mayor. And again, there's no decision-making involved tonight. This is to bring to the board's attention some changes that we anticipate in the next public health order that, Becky or Jim, did it come out? But it's going to allow outdoor, patio seating. We've kind of quasi gotten there already with public picnic tables, but this is more of a situation where You know, a restaurant in town could have a barricaded space out in front of their restaurant using their own private tables and chairs, not only serving food, but also serving alcohol. Current liquor licensing does not allow for liquor to leave the premises, the indoor premises in any way. So it's something a lot of communities are considering or already doing. You know, we, you know, have no opinion on it yet. The first question is, does this board have any, you know, negative thought about it? That because this will take staff time, Paul Kosnick time, Anthony Edwards time, if we're to start to craft ordinance and liquor license changes. So if the board is wholly against allowing an outdoor patio situation with open container out in those patios, then we wouldn't pursue it. So that's the first big question. Is anybody, you know, vehemently opposed on the board to us pursuing this and beginning to prepare? Because I'm assuming every restaurant in town is going to want to do this, if allowed. So if that's where we start, is to take the board's temperature on, is this something everybody, or, you know, however many are in agreement with pursuing? Or is there another side where you're not of the opinion that we should pursue this? Because we don't want to start the meter ticking on staff time and attorney time and Judge Edwards' time if the board doesn't want this to be pursued. So that's the first question.
Trustee Raw.
So working, okay. So I know that there is the ability to add into your square footage on your diagram when you send it to the state to add exterior dining. Durango does it, and they put up the little kind of fence, and it's directly attached to restaurants. I want to say it's called something. I want to say it's called, like, I don't know, bistro dining or something like that, open air, something like that on the sidewalk, and that it actually creates the extension of your liquor license into that space. But that's actually looking at it from a standpoint of it being permanent. So I know there is precedent out there that this does actually exist. People are pushing it right now because of the COVID to create additional space because you've lost it inside with the social distancing. So I know that it wouldn't be hard to find the correct wording for some of this, to the judge, to Mr. Kosnick, and to Mr. Ryder, because there is precedent that it exists already. So I am obviously in favor. Thank you.
Thank you. Trustee Birma.
I'll keep it short and sweet. I just would say I'm in favor, and I think it's worth pursuing.
Thank you. My question, I'll do input real quick. I would want to just hear from Judge Edwards and from John Seitz about the process and making sure that whatever process it is to obtain this wouldn't be prohibitive for certain businesses or unfair for certain businesses, and that it's something that everyone can benefit from. And then from John Seitz, that the logistics related to doing this and that the traffic flow and pedestrian flow remains safe, and that we're not creating other consequences that are negative for the town by doing this. But in general, I think it sounds like an awesome idea, and I'd like to see it happen if there aren't those other issues. Trustee Lashley.
Thank you, Mayor. I'll try and keep it short and sweet here as well. I'm in favor of staff looking into this, and I've spoken with a few of the staff members about this, and I think they've got most of kind of the major issues on their plate that they need to work through, and I'm excited to see what they come up with.
Trustees Wiegert or Harper or Mayor Pro Tem Barney. Trustee Harper.
I'm in agreement with this. I like it. I think we need to do everything we can at this time to be hospitable to our guests and to our fellow neighbors and friends throughout the community. And I think this is a great way of getting everyone together.
Thank you. Mayor Pro Tem Barney.
I totally support it. I think it's a great idea. And I agree with you, Mayor, that it just needs to be equally accessed by all businesses.
Trustee Wiegert.
I'm good with it. I've said before that I think whatever we can do to allow people to make a living and operate their businesses is steps that we should take as people who support this economy in Silverton. So I'm good with this.
I may also add that both Chief Archuleta and Sheriff Conrad appreciate the concept.
Thank you. So I guess let's kick this over to Judge Edwards and John Seitz, Public Works Director, to see if you have any particular input at this stage that you'd like us to know, or if you're good with it as well.
I don't want to weigh in one way or the other, right? Because I administer whatever we do. I will say this: I've had some input. I want to make sure that we know the different options. There's an open container law. Could we change that or amend that? I leave that up to Paul, and we can talk about that in our regular ordinance. There's the entertainment district. Could we expand that? That looks like it might be a little complicated. And I know that the bulletin right now from the state, the emergency bulletin allows for some things to happen for 6 months. I think that's the time frame. That's my recollection. Maybe it's 120 days. Anyway, Kelly and I have been talking about it, and we're hoping to meet with the sheriff at the end of the week to get some input as well. I think he's tied up in some other matters right now. But my thought is let's explore it and find the best way and options to achieve what we're trying to do, which is to create more options for everybody. And as Trustee Harper said, come together.
Thank you. John Seitz?
Sure, can everyone hear me okay?
We can.
We haven't gotten too deep in the weeds on the details of the businesses operating in the street, other than obviously we've been doing it to some extent for a couple of weeks. We're definitely looking for direction from the board, and it sounds like we have that. Regarding a one route, I have done some work. It's definitely possible. It would look something like Green Street northbound traffic would continue the way it has been. I'm not sure if you can see this map that we put together. It's not very detailed, but Green Street northbound would stay the same. We'd move the planters into the southbound lane. We'd have to install a lot of probably portable one-way signs. It would loop back around down Blair. We would also have to have signage coming down out of the county. This plan is in its infancy, but I can tell you that it's doable. I had a brief conversation with the sheriff about it. He thinks it's doable, but this plan, along with the merchant plan, Green and Blair Street, need more work. And it sounds like we are about to be directed to do more work on this.
And again, I would point out the goal of the one-way Green Street idea is twofold. Number one is to create a more vibrant streetscape on Green, and number two, to loop and encourage people to loop over to Blair to help their volume of business.
Trustee Roloff?
I guess I have one concern, just because from the blocks of 10th to 14th, we've got the pickleball on the opposite side. That's the only thing I worry about, that how would we help them make sure we extend it properly Do you know what I mean? To make sure that it's fair that way, because they're the only one on the opposite side of the street. You look at, yeah, 3, 4, yes. So, and then coming down the other direction, we've got so many on either side. So are we more like cutting it out and it would just be, because I couldn't quite decipher John's map properly. So we'd kind of be cutting it out in just the center. So the center would be going up, and then at 14th, see, everybody's faces are in the way. I don't know how to manipulate this right for myself. Okay. So we would just basically use the what do we want to call it? Age. The center lane where we allow people to drop off and deliver. We'd use that as a one-way, and then we'd use the center of Blair Street coming down the other way. So that way we encompass all businesses on each side of the street to make sure everybody has the opportunity to utilize it. Is that what I'm seeing, or am I wrong?
Mr. Ryder, Mr. Seitz, would you like to clarify?
Sure. The northbound or right-hand lane of Green Street would be the one-way lane. The commercial loading zone would remain a commercial loading zone. The southbound lane would be like an open street without traffic, except for cars going to and from parking on the west side of Green Street. So it would be more or less business as usual. Now, I would say that some conciliation for those businesses on the east side of Green Street, like the Pickle Barrel, maybe you could give them a little bit more room as far as outdoor seating goes. But a lot of your restaurants are going to be on the west side, but a lot of shops and restaurants are going to be on the east side. But it just makes sense to have, we're still going to have a commercial loading zone.
Yeah, I guess my question would be if we're allowing, how this dovetails with open containers. So if people are ordering drinks from the Pickle Barrel and they have to get those drinks from the Pickle Barrel across 2 lanes to the seating area on the other side of the street, just making sure that that works. And then the same thing's true for however the seating's set up on Blair.
That will require more planning.
Yeah. Trustee Lashley?
Thank you, Mayor. I think maybe something that might help for the Pickle Barrel is if we allow them to set up their outdoor seating on the south side of their building rather than on the Green Street right of way there. Since they kind of have the vacant lot across the street, I don't think there's as much side street parking. Input from Paul Zimmerman on that would probably be helpful before we make any determinations on that for sure.
Yeah, and that sounds like a great one for that one. I'm sure you guys will think about that, but then also figuring out how it is done equitably on Blair Street. Trustee Barella?
Actually, Judge Anthony had his hand up first.
Oh, yes, please.
Thanks, Trustee Barella. I think we could get really stuck in people walking across and what they're going to do. I think that's going to get a little complicated. And we want to, if Paul Kosnick and John and myself could work on, when Kelly, could work on the different scenarios and get them to you, I think it's going to help us from going in circles about some different things. And we have the call, you've informed us to do it. I think it's going to take us 3 or 4 days, maybe 5 to really get that in there, but just let us do that first. I think it'll help you all from getting caught and for us to be thinking of scenarios that may not be possible.
Yeah, thank you, Anthony. That was exactly the purpose of this discussion, just to make sure there wasn't a slam dunk, do not pursue that type of sentiment. And we're not hearing that, so we'll go forward with the details.
Trustee Barella.
I just want to make sure that all restaurateurs and anybody who wants to utilize this is highly informed about this, because this is very vital to the economics of survival of all of them. I don't know how, other than pushing potential more attendance. I don't know, is this something that next week, or when this is done in say a week or so or 2, we actually, I don't know, could we hold a real meeting at the thing and have everybody socially distanced? I don't know, because this is very, very important. I don't want any miscommunication or dropping off like what happened today. I'd rather not have my phone blow up, and I'd actually rather have people hearing it from us directly. I don't know, just a thought. I just wanted to throw that out there. Thank you.
My understanding is that we still have I expect this to change pretty quickly. I don't know if that's an unrealistic expectation, but that we still have the group gathering limit of 10, which limits our ability to have in-person meetings open to the public. Since restaurants that have sufficient occupancy are permitted to be up to 50, I imagine the state will pretty quickly come to realize that conflict and fix that and allow gatherings of 50, or who knows what the state will do, but
Or we have meetings in restaurants. Sorry, Mayor.
That's a good call. Yeah, we could just have the meetings in restaurants in order to avoid the gathering issue.
I just want to caution too that staff has a lot of capacity, but its plate is full, and to do meaningful analysis and meaningful plans so that we can have meaningful discussion. I see next week's meeting already being another marathon for a variety of reasons. So just a caution: if you want a good product, you got to give us a little time to develop a good product.
Thank you. Trustee Lashley.
Thank you, Mayor. I am completely in support of trying the one-way idea as well, since we've kind of shifted discussion there. I will say that we definitely need to accept public comment and hear the public out on that. This is something that kind of has been suggested for about 10 years and been fairly contentious in our community. So I'd like to hear a lot of public opinion before I make any final determination. But as far as staff direction, I think that's a positive route to take. I would have to say to Administrator Ryder's comment there that I think the first aspect of our conversation here, talking about the outdoor seating and liquor licensing, is a lot more important than the one-way discussion, but maybe some of them tie in more than I realize.
Thank you. To not belabor the point, it sounds like we're in a pretty good spot and we can let everybody go home relatively early. We're not quite done yet. Two things. One is that a few people shared the public comments that they received directly. I think I would be remiss to not share a comment that I've received from many people over the last 2 weeks, which is dealing with the sign and there not being clarity in the community about who controls the sign, and if it is the sheriff or if it's the Colorado Department of Transportation. And if we have any say in that, the request that I've received many, many times is either to remove the sign or simply change it to "Welcome to Silverton," something like that, and let the in-town advisory exist. I would say, rather than adding a new discussion topic to this agenda, if we can maybe add that to next week's agenda to just have a discussion or clarification on what exactly the deal is with the sign, so that that can be something our entire community understands clearly. And then I apologize, I should have noticed this at the beginning in terms of revisions to the agenda, but we typically open and close meetings with public comment. This agenda doesn't include a public comment at the end. I'd ask this board to allow the attendees who do have their hands up, of which we had 2 before, now 1, to provide that end of meeting public comment if no one has a big objection with that. Okay, and I now see the two hands I saw before back up. So I will now add Melody Skinner to the panel in order to provide public comment. Melody, the floor is yours.
Can you hear me?
Yes, we can.
Oh, very good. So, as long as I've lived here, which is like 40 years, there's been a long time joke in Silverton about having everybody come into Blair Street and go down Green. And that, of course, was by Blair Street business owners. But I've heard it from the day I've lived here. So, not to say whether it's a good idea or not, but I do think that you need to think about a traffic flow engineer to look at everything because you're going to have to sign everything very legally and very well if you're going to be mixing pedestrians and also confusing the locals with going up one side and down the other. You'll have to have all the legal signs for uniform traffic control devices in the state of Colorado posted at a proper height, the exact sign. You can't make a left turn here, you can't make a right turn there, that kind of stuff. I do want to caution you about doing that because usually what happens when you change a traffic control device, like say at a stoplight, you increase accidents. So think very carefully about how you want to do this and get some good advice from a traffic flow engineer. I'm going to harp on that just a little because I've been harping on it for probably 25 years. We used to have traffic control studies done for the town of Silverton occasionally. And I believe I have the last one in my possession, which was about 30 years ago. And I know you don't have the funding for it now, but it would be very good at some point to have someone come and do a traffic study here and see what's good, what's bad, and what we can and can't add in a really good legal manner for the safety of everyone. And you guys have had a wonderful conversation tonight. It's been enjoyable to listen to you discuss every issue that I can imagine on masks or not. And I appreciate the thoroughness. Thank you.
Thank you, Melody. All right, we have one other hand up from, I believe this is Cole Davenport.
Hey, thank you, Mr. Mayor, and everybody else. Mel was right. She's completely 100% correct. She took the words right out of my mouth. I served in the military for a number of years, and it was a motor vehicle operations. And if you guys do such a thing like this, you do have to consult somebody. Exactly what she said about the sign heights, everything else, pedestrian safety. It is really, truly a costly effect. It could be to go ahead and change this town around. Whether it be good or bad, yeah, I mean, it can be cool, but to think about and changing something like that is progression. You guys are doing good. I like the way you guys are progressively thinking. But with that being said, there is a lot of implements in how you guys go about and having to change all these signs and stop signs and putting in new stop signs, putting in red lights eventually. I mean, it can really start to affect some places and how the town wants to be and how the image the town wants to keep. But with that being said, I will yield my time to whoever wants to speak, and thank you guys for your listening to my input. Good night, y'all.
Thank you very much, Cole. Lisa, I suppose we should also just double check quickly that there are not additional comments on the YouTube channel, other than the interim one that was provided in our text.
Yep, there are none.
Okay.
That was my question.
With that, I would like to apologize to Trustee Wiegert for asking him to control his emotions. I think that was inappropriate of me. I do stand by the comment that I'd like us all to use a professional tone when communicating with each other, even if we're frustrated. So I'm sorry that I said that to you earlier. With that, thank you all for a very productive discussion. I believe that this was helpful for the community to hear, and I look forward to seeing you all again in a week. It is 8:47, and I adjourn this meeting.
You.
Thank you. Good night.
Good
Good night, everyone.
Thank you. Bye.